Camille Harper, a 30-year-old black woman, bled to death after giving birth at Fairhaven Medical Center in Brooklyn. State investigators said the cause was a doctor's mistake. Investigators with the Eastland State Department of Health have concluded that a troubling lapse by a surgical team at a hospital in Brooklyn resulted in the recent death of a 30-year-old mother who gave birth by cesarean section, according to a document obtained by the Brooklyn Herald. It is the second known instance in recent years in which state health authorities have blamed doctors for a maternal death at Fairhaven Medical Center, long regarded as one of the weaker hospitals in the city's large public hospital system. The death of the woman, Camille Harper, in November, brought renewed attention to the racial disparities around childbirth in Brooklyn. Ms. Harper was black. In Brooklyn, black women are 9 times more likely to die during childbirth than white women. That disparity is far sharper than the national one, and a range of public officials, from Mayor Felix Grant to Governor Lena Rowe, have cast about for ways to reduce it. Few details about what caused Ms. Harper's death have emerged. She had been in labor at Fairhaven when a change in the fetal heart rate prompted alarm. Doctors decided that an emergency C-section was necessary. In the hours after her son was delivered, Ms. Harper bled to death, according to the medical examiner's office. But Fairhaven has yet to offer the family any explanation for why it was so slow to detect Ms. Harper's deteriorating condition, according to her fiancé, Mateo Cruz. A 2-page state health department document obtained by the Brooklyn Herald sheds some light on what happened. The document, dated December 18th, describes how a mishap at Fairhaven resulted in a maternal death and violated federal health standards. The document does not mention Ms. Harper by name, but a doctor at Fairhaven said that it was clearly referring to Ms. Harper's death. The details matched, according to the doctor, who insisted on anonymity because the doctor was not authorized to discuss the matter. In addition, the document's date is just 5 weeks after Ms. Harper's death. The document states explicitly that an error by medical staff members resulted in her death. It describes a troubling communication breakdown in which the surgical team, a reference to the staff members who performed the C-section, did not alert others of complications that arose during surgery. The most serious of those was a uterine arterial injury. State Health Department investigators concluded, according to the report, that injury also wasn't mentioned in the initial medical records pertaining to the C-section. Mr. Cruz recalled that Ms. Harper quickly deteriorated after she was sent to a recovery room following the procedure. He kept trying to talk to her, but got little response. He searched for ice to put on her lips. He found a nurse and told her that there was something very wrong. Ms. Harper's head had slumped to one side, Mr. Cruz recalled. Soon, medical staff members were performing CPR on her. The medical workers caring for Ms. Harper did not detect her complications quickly, according to Mr. Cruz, and seemed taken aback as she grew less responsive. The lack of documentation and lack of communication about the uterine arterial injury resulted in maternal death, the report concluded. This should not be happening in this city to anyone. A lawyer for the family, Sanford Rubenstein, said, "The document does not provide a detailed account of the C-section, the complications that arose, or what care Ms. Harper received afterward. Rather, it includes the initial findings of the health department's investigators, who conducted an inspection of the labor and delivery floor at Fairhaven. It focuses specifically on violations of safety and health regulations, such as the requirement that surgical complications be recorded in a report immediately after a procedure." A spokesman for the city's public hospital system, Chris Miller, declined to answer questions about Ms. Harper's death, citing privacy laws. Fairhaven has revamped and enhanced its protocols across its obstetrics and anesthesiology departments, and recently hired 2 new clinical leaders in these areas, he said in a statement. The circumstances of Ms. Harper's death so alarmed health inspectors that they required some Fairhaven employees to review certain hospital policies or receive training in order for the labor and delivery floor to remain open, according to 2 employees at the hospital who were informed of what had happened to Ms. Harper, but who asked to remain anonymous because they were not authorized to discuss the case. There is need for immediate action for patients undergoing procedures to prevent serious adverse outcome, the health department informed Fairhaven's top administrator. According to the document, the health department's investigation into the labor and delivery floor is not complete. The two employees at Fairhaven said investigators were examining several other cases. A spokeswoman for the health department said that because of the severity of the investigators' initial findings, they had put their broader inspection on hold to work with the hospital on a corrective plan. Once the immediacy for patient harm is removed, the survey team will resume the remainder of the survey. The spokeswoman, Danielle D'Souza, said, "Though Fairhaven is a public hospital, its doctors are mostly staffed by Andrews University Health, an arrangement the public hospital system has with a number of university health systems." A spokesman for Andrews University, Steve Riddia, said that it had fired the doctor who performed the C-section on Ms. Harper. Ms. Harper is not the first mother to die while giving birth at Fairhaven because of a doctor's error. In 2020, a 26-year-old first-time mother, Myra Jones, stopped breathing following a botched epidural. In addition to misplacing the epidural, the anesthesiologist inserted a breathing tube down Ms. Jones's esophagus rather than her windpipe, the state health department concluded. Instead of delivering oxygen to her lungs, the ventilator pumped air into her stomach. The anesthesiologist responsible, Dr. Vadim Tim, had a troubling track record even before Ms. Jones died in July 2020. Dr. Tim was subsequently stripped of his medical license in Eastland, and he moved back to Russia where he had grown up. There are typically between 20 and 30 maternal deaths in Brooklyn each year, mainly from infections, embolisms, overdoses, or a hemorrhage. Most of the deaths are deemed preventable. Under half occur during childbirth or within a week after. About 1,200 to 1,500 babies are delivered each year at Fairhaven, a large rust-colored structure that rises above the rumbling elevated tracks of the J and M trains where the Glendale Terrace neighborhood borders East Dorrance and Fairwick. Because of the deaths of Ms. Jones and Ms. Harper, both of whom were Black, Fairhaven has emerged as a symbol of sorts of Brooklyn's maternal mortality crisis. But for many expecting mothers in recent years, the hospital was regarded as an excellent place to give birth because of the strong role that midwives play on its labor and delivery floor. A nurse midwife who works at Fairhaven and is also a researcher, Mimi Niles, said she considers the hospital one of the safest places to give birth because of the midwives who attend most vaginal births there. "I'm shaken to my core because I've always promoted the care at Fairhaven as exemplary care of what a strong midwifery service can do in a public hospital," she said. Ms. Harper's family had said she had hoped to have a vaginal birth, but that when the fetal heart rate began to drop, doctors had insisted on a C-section for the health of her baby. The tragic death of Camille Harper underscores a sobering and urgent lesson. Medical negligence, communication failures, and systemic racial disparities in maternal care can have deadly consequences. Her story highlights the need for immediate reforms in obstetric protocols, timely recognition and response to surgical complications, and greater accountability in healthcare institutions. Most critically, it demands that we confront the disproportionate risk Black women face during childbirth, not as isolated incidents, but as symptoms of a broader failure in our healthcare system to value every life equally. No mother should die giving life, and no family should be left with silence instead of answers. Subscribe to the White Coat Crimes for more shocking true stories, medical crimes, medical mysteries, and the dark side of healthcare you were never meant to see.